Hey, my name's Sue. I'm an approved mental health professional.
And I'm Ewan. I'm a consultant psychiatrist. Section 3 of the Mental Health Act is commonly known as a treatment order. It allows for detention of a patient for treatment in hospital based on certain criteria and conditions being met and appropriate. Criteria that the patient is suffering from a mental disorder, that mental disorder is of a nature or a degree warranting the treatment in hospital, and also that certain risks must be in play, that either there's risks to the health of the patient, the safety of the patient, or there's risks to others who need to be protected. There are a couple of further conditions. One is that the treatment cannot be given without the Section 3 being in place. And finally, appropriate treatment must be available for the patient for the Section 3 to be able to be put in place.
In order to assess somebody under Section 3, you need two doctors, one who is what's called a Section 12 doctor who has a psychiatric training, and the other doctor preferably is somebody who knows the patient well. So first choice is usually the general practitioner, and you need an approved mental health professional. As an AMP, I need two medical recommendations in order to make an application under the Act. So if one or other of the doctors isn't prepared to make a recommendation, then I can't make an application. For a Section 3, I also have to consult with the nearest relative, and there are certain circumstances in which I may not do that. Those are that it's not practicable, or that there would be an unreasonable time delay. But ideally, I would always consult with the nearest relative. And if the nearest relative objects, then I wouldn't go ahead and make an application under Section 3. There's a subtle difference between agreeing with detaining somebody and objecting, so that sometimes the relative is happy for me to make the decision. They're not exactly agreeing, but they're not making an objection. Section 3 can last for up to 6 months. Usually, though, the person is better or more able to accept voluntary treatment or treatment at home much quicker than that. So the fact that they can be detained up to 6 months doesn't mean they necessarily will be detained under 6 months. As soon as the criteria for detaining them are no longer there, then they have to be discharged from the Section 3. If they're not happy with the detention, they can appeal at any time to a mental health review tribunal, who will then ask for reports and will decide on the day whether the criteria are met. They can also appeal to the hospital managers to have their detention looked at.
An example of a time when you might consider using a Section 3 would be if somebody was well known to the team, the community team, if they were under the care of the community team. If it became apparent, though, that person was becoming more unwell, they were maybe becoming less compliant with their treatment, which was a known risk factor for them becoming more unwell. And if there was concerns about their lack of insight, their lack of understanding about their illness and symptoms that they had, and about what might happen if treatment wasn't restarted at some point in time, and there was a concern that deterioration would continue and the risks mentioned earlier might increase. There might be the risk to the patient's health, but also risks to their safety or to risks to others. And in those instances, I think you might have a clear view that what that patient maybe needed was for treatment to be restarted, but that at times the only way that can be done safely is to be restarted in a hospital environment, and that might be a situation where you could have a specific treatment plan for that patient, and you'd use a Section 3 to enable that treatment plan to happen.
So part of my role in the assessment would be to consider whether there are any less restrictive alternatives. So, for example, I might look at whether they could be treated at home, and I'd need to take into consideration the carer's ability to carry on caring, what kind of stress they might be under, other risk factors such as are the young children in the home, how's it affecting them? And the other possible alternative would be, will they agree to go in voluntarily, which obviously would be preferable to detention.